Hey everyone!
It's Chanel
And Janine
from Asian Communities for Reproductive Justice.
Last month, President Obama announced that as part of the Affordable Care Act, health insurance plans are required to offer birth control to women free of charge. This means that if you or I have access to health insurance, then we'll be able to access the kind of birth control that we want to use to take care of ourselves.
Traditionally, religious affiliated organizations have not been required to provide birth control for their employees. But today, the Obama administration has required that insurance companies make birth control available to employees of religious organizations who choose not to provide it.
For example, if you know someone that works at a religiously affiliated organization, such as a church or a hospital, their employer is not required to provide birth control on their health insurance plan. However, the insurance company alone can provide free birth control to the employee.
Yeah, some politicians and religious leaders are going to be mad. Conservative politicians in the Senate and the House of Representatives are pulling out all stops to ensure they restrict our access to birth control. But the reason the Obama administration is enforcing these policies is so that every woman has a right to choose. Nobody's forced to buy or use birth control. And this policy protects religious freedoms by ensuring that churches and other places of worship do not have to offer coverage.
But some people don't think that women should use birth control at all, and those people will continue to fight this policy.
Here are some things that you should know as the fight for access to birth control continues. Contraception is not only used for family planning. It is also used to treat many health conditions that affect women, like ovarian cyst, fibroid tumors, and abnormal bleeding.
All low-income women, especially young women and women of color, have a hard time affording birth control. This new law will save some women up to $600 a year.
99% of all women and 98% of Catholic women have used contraception. To be honest, sometimes women disagree with their churches.
While most of the controversy around this decision focuses on birth control, this decision is about many other things that are especially important to low-income women and women of color.
In addition to contraception, this decision requires that insurance companies provide free preventative care, like cervical cancer screenings, HPV and HIV screenings, in addition to counseling around sexually transmitted diseases.
Women of color are at a greater risk for many advanced stage cancers and HIV because of a lack of access to prevention and early detection.
So these changes in insurance coverage are one important step in mitigating health disparities within our communities.
We hope this information has been helpful. For more information, please visit our blog at www.reproductivejusticeblog.org.